What are the popular facial surgeries we do in our practice? Or what are the popular facial surgeries patients demand in our practice? Of course, hair transplant is very common procedure when we talk about facial cosmetic surgeries, and we do a lot of hair transplants in our clinic. Any patients who want to learn more about hair transplants do visit us, and of course we can tell more. But let's talk more about facial contouring surgeries beyond hair transplant. So the most common surgery we do are eyelid surgeries and rhinoplasties. Now eyelid surgeries, many are for people, many men and women who have excess skin in their upper eyelids. Their upper eyelid starts drooping, or their lower eyelids have eye bags, they have hollowness beneath the eye bags. All these issues can be treated simply by a daycare surgery called as blepharoplasty. So in upper eyelid, we remove the excess skin. If they have excess fat, we also remove that. The scar is always hidden, nobody can see the scar. Lower eyelid, we try doing this surgery most of the times by a transconjunctival approach so that the scar is not even given in the skin. We remove the eye bags. If skin needs to be tightened, we can also do that. We also make sure that they have a smooth eyelid to cheek junction by doing a facial fat transfer so that we take away the hollowness beneath the eyes and also improve dark circles. So this is in just about the eyelid surgeries. Then we move beyond and come to nose. Now rhinoplasty is very commonly done. Patients may get it done for functional issues like they have difficulty in breathing because they have a deviated nasal septum, or they may also do it for functional issues like they have a broad nose, they want it to be a fine and a thin nose or a sharp nose, their tip needs to be defined, their tip may need to be rotated, they have a depressed nose, they may want to get it raised, they may have a hump which they want to correct. So all these issues can be corrected by a rhinoplasty, or also called as nose job in a layman terms. Again, we do rhinoplasty as a daycare surgeries. Most of the time the patient goes back home the same day. Next day they can resume all their daily activities. There will not be any pain. We do use technologies like ultrasonic rhinoplasties so that the tissue trauma is minimal, recovery is faster and smoother. Apart from that, we also do face fat grafting, as we have already talked about in several of our videos, which helps augment certain areas of the face which have lost volume as a person ages. Then there is something called as buccal fat removal. Many men and women may have a chubbier lower part of the cheek, and that part can be removed by a simple 10 minutes procedure in which we give an incision inside the cheek, squeeze out the fat. Daycare procedure, 10 minutes, they go back home the same day, resume their daily activities, and even eat and drink from the same day. Beyond buccal fat, we can do chin augmentation by chin implants, a permanent result, a very fast recovery, 20 minutes procedure against daycare. You can see some of our results and you will see how this can change one looks and feel about themselves. A very powerful surgery to give you a nice definition of your jawline as well. Then we can also do face liposuction and neck liposuction along with tightening of the skin of the neck by neck tight so that they get a nice chiseled jawline, removal of excess submental fat, a better looking face, a much more confident looking face. These are simple procedures which I've talked about in this video. Each procedure takes less than an hour and are daycare procedures, but can have a profound effect on how a person looks and feel about themselves. If you have any questions about any of these procedures or any other cosmetic surgeries, please connect with us. Me and my team are always there to help you, guide you scientifically.